Hi guys, this is part two, so we're just going to finish our slides and then we'll do a review of the most important parts. So again, spinal cord injury occurs mostly in young men, 81%, and the rest are generally elderly adults, average age 33 years old men. Mostly due to MVA, so motor vehicle accidents. And like I mentioned before, the severity of injury depends on the intensity of the force and if you had any pre-existing conditions. So if you're an elderly person with disc degeneration to begin with, you may obviously fracture more easily. What area of the vertebrae is injured, so whether your transverse or spinous processes actually dislocate or whether they break into several pieces and they're actually fractured, or if the tissue underneath, so the spinal cord tissue, actually is compressed or sheared. So sheared means torn. So any of these will cause some kind of injury depending on where it is. And if the vertebrae actually move, any of you who've ever had a dislocated vertebrae will know that that also is incredibly painful and can affect your movement and sensation. So again, the damage and the intensity and how long it lasts for, and if you have paraplegia or quadriplegia or what kind of damage you have depends on the intensity and of the damage and where it is. So some examples of what happens is within minutes we have small bleeds, swelling, and decreased blood flow to the area. Then we may have no oxygen delivery and then an infarct of that actual tissue and more bleeding of the area. And so depending again on where the damage is what kind of injury we're going to see. The most common locations to have a spinal cord injury are in the most mobile portions of the spine and the vertebral column. So it would be the cervical vertebrae 1, 2, 4, and 7. So here, 1, 2, 4, and 7 in the cervical vertebrae, and also in the thoracic lumbar area, so your low back. So T1 to L2. So T1 to L2, also very common site of injury. If we have damage to C3 to C5, so up here, and we have damage to the phrenic nerve, which is a nerve that that stimulates my diaphragm to move up and down so that my lungs can expand up and down so I can breathe. If we have damage to the phrenic nerve from injuries to C3 to C5, we can actually have damage to our diaphragm and we will not be able to move our lungs appropriately and we won't be able to breathe. So that can be life-threatening. There is also something called autonomic hyperreflexia that can occur with anything above T6 that can cause us to have crazy high blood pressures. Remember, normal blood pressure 120 to 140 to 150 to 160 depending on the person, and bradycardia. So decreased heart rate, anything under 50 is a bradycardia. So that is called autonomic hyperreflexia and that can occur with damage to anything above T6. So a picture of your spinal cord, damage your vertebrae and damage to the surrounding vertebrae, and what kind of injury depending on where it is. So the higher up your injury, if it is a severe enough injury, anything below may develop in quadriplegia. There is incomplete and complete of both quadriplegia and paraplegia. So quadriplegia is not being able to move your entire body. Paraplegia is part of your body. And complete would be you're completely immobile, and incomplete is you can move a little bit, some parts. A herniated disc that some of you may have had before is displacement of the actual disc. So, but the part of the disc that we're talking about is the nucleus pulposus. So displacement of the disc where the disc is not supposed to be. So what can happen is it can cause, here's a nice picture of it here, and now we're compressing our spinal nerve. So really, the disc should be here. So the nucleus pulposus should be here inside the intervertebral disc. But what's happening is it is moved, it is displaced, and it's compressing a nerve. So that is causing inflammatory changes. It can cause pain. It can cause difficulty with mobility. Really common in men, again, and in people that are doing repeated lifting, so weightlifting. The most common areas for herniated discs are the lumbar region, so the lumbosacral region, L4 and L5, and L5 to S1. So if you remember, those were in the lower back. We can also have pain radiating down the sciatic nerve. The sciatic nerve, anyone's ever had sciatica? Sciatic nerves runs from basically the top of your bum down your leg, and that can cause a lot of damage to the sciatic nerve, and people complain of this nerve pain, that burning pain that runs down their bum all the way down to the end of their leg. That's caused by herniated discs in these lumbar and sacral areas. So what I want to do now is just go back and do a quick review for you of the most important things. Although all these slides are important, I just do want to tell you again that this slide was a review of the spinal cord and the nerves that were in the spinal cord, 31 pairs of spinal nerves that get their names from where they exit, what level of vertebrae. So cervical, thoracic, lumbar, and sacral. And then talking about peripheral nerve injuries, so that can be an injury to the axon, spinal cord, plexus, or peripheral nerves. The most common causes of peripheral nerve injuries are diabetes and alcohol abuse. And so we can either have a generalized neuropathy that affects the cell body, but one type of peripheral neuron. So that can be something like ALS. Or poliomyelitis, or we can have a focal or multifocal neuropathy. So when we have an area like in carpal tunnel syndrome, where there's only a certain nerve, the medial nerve is affected or the ulnar nerve is affected, that is a focal or multifocal neuropathy. Peripheral neuropathies such as diabetes cause damage from glycoproteins, sugars, free radicals to the large and small vessels, which is called angiopathy, and eventually they damage the actual nerve themselves. And so we have damage to the actual nerve, say, of the foot, from diabetes, and then that person would have all the neuropathy that goes with having a damaged nerves to that foot. So decreased sensation, you can't tell hot from cold, decreased healing, people get diabetic ulcers. So again, that's an example of a peripheral neuropathy. Nerves can regenerate depending on how close they are to the cell body. So if we have an injury, like a crush injury, I hit my arm and it gets crushed in between something, and we have damage to this part of the nerve, it may regenerate through the inflammatory process. If we actually damage the nerve itself, the cell body of the nerve, so I've cut my hand with a really sharp knife, that is not going to recover nearly as well if it recovers at all. Again, examples of brain trauma, most common in males, lower to median income, babies, so 4 and under, and adolescents, and older adults, greater than 65 years old. Motor vehicles are the most common reason. So there's this part is primary injury, so this is from the direct impact, and then this is a secondary injury. You can either have a blunt head trauma where your head strikes a hard surface, or a rapidly moving object such as a baseball bat hits your head. This would happen, we will have DIA, so diffuse axonal injuries here, but the dura remains intact, the brain tissues are not exposed, the skull is not fractured, and if it is, it's a closed fracture. Or we have an open or penetrating injury, so a gunshot wound. This will cause injury to the dura and the cranial contents. We can have a focal brain injury, so a small part of the brain, like example, we have a bruise to our brain, like as in a concussion or a hemorrhage from a stroke. That is an example of a focal brain injury. Contusions are blood leaking from tears in blood vessels. It's normally a slower type bleed, but it can lead to hematomas, so big bleeds, hemorrhages, and then infarction and necrosis, so stroke and then death. This will also, anytime you're bleeding in your brain, you will have edema, which will increase your intracranial pressure, which will decrease your cerebral perfusion pressure. These injuries here are called coup and contra coup. So the site of impact, when I hit my head on the windshield, that is a coup, as my head, where I have damage, direct trauma to the brain, may have a fracture, subdural hemorrhage. We may have DIA. And then when my head flips back, I also may have damage to the opposite side of my head. That is called the contra coup injury. And that is from shearing forces through the brain. Areas of bleeds are either epidural, so above the dura mater, subdural is below it, or intercerebral, and some pictures of that. And spinal cord injuries most frequently happening again in young men, most frequently happening due to motor vehicle accidents. And the area that is affected and the kind of damage you have depends on where in your spinal cord is injured. The most common locations for injury: cervical vertebrae, cervical spine 1 and 2, 4 to 7, and the thoracic lumbar from T1 to L2. Those are the most mobile portions of the vertebral column, and that's why most of the injuries happen there. If you have damage to the phrenic nerve, which is the nerve that stimulates my diaphragm, that controls my diaphragm to move up and down so my lungs can expand and I can have gas exchange. If I have damage to that, because I have damage to C3, C5, that may be life-threatening. I may not be able to move my lungs to breathe. That's why you see people that are paralyzed on ventilators, because they've had damage to not only all the muscles that go with respiration, but they also have damage to the phrenic nerves. So we can either see complete or incomplete quadra or paraplegia, depending on where it is. And the last thing is our herniated discs, and that can compress the nerve root, causing pain and inflammation and something called sciatica. And the most common areas for that to happen are in the lower back. So L4, L5, and L5 to S1. I hope that helped. Don't worry about those. So I hope that helped. And please let me know if you have any questions. Thank you.